My understanding of planetary health is it's fundamentally accepting that our health is intricately linked to the health of the air, land, and water around us. And that when we're promoting human health as nurses, we have to consider how our actions are also impacting the air, land, and water.
Human health and the health of the planet are connected, and that they're sort of inseparable, and that one influences the other.
We are one with the environment. We look after it, it looks after us.
I've got 2 little kids, and I think a lot about the world that they're growing up in and what it will look like when they're older, and wanting to make sure that I'm contributing in a positive way.
What made me interested and committed to planetary health was just the idea that human activities, that the level of impact that it has on the environment, and the impact being mostly negative, and just progressing the degradation, deterioration of environmental conditions is really what drove me being involved in this work.
Do that. As a nurse, I can protect the health of my patients, my people, and my planet together, because the link between these two is so inextricable that I get to have so much fun in caring for people and planet together, because it's all one piece. You cannot care for one without the other.
Climate change is going to impact everybody we love and every place that we love, and that I have a voice as a nurse because people trust nurses. And I thought, I need to be using that voice more.
The number one would, of course, be the greenhouse gas emissions, of course, the level of CO2 that's emitted in the air, especially from, transportation, like the oil and gas. Where I'm really concerned is the artificial intelligence, so AI, how we're seeing AI being used so much more generally in society.
Extraction and burning of fossil fuels is the main driver of climate change. So that's the thing I think we absolutely can't lose sight of, have to keep our focus on, and absolutely have to change. When I'm ready to buy a car, I'm not going to buy another gas-powered car. I buy an EV, or whether it means I've decided I'm no longer going to commute by car, I'm going to take transit, or I'm going to ride with a friend, or whether it means I'm going to vote for climate-friendly politicians. Whatever steps it is I'm going to take them in my home, in my community, and then in my workplace. Climate change is the biggest threat, but biodiversity loss is just an enormous threat. Remember when the bee population was going down, and there was all this stuff in the press about all the things that bees do for us, and that if we don't have bees, like our crops won't get pollinated, we will not have food to eat. And then plastic pollution is a huge problem.
Environment is much larger than just where we're seeing these patients come to us. Their environments where they live, breathe, eat, interact is, what's impacting their health. We're just getting a quick snapshot of what that, impact is.
We really pride ourselves on the advocacy piece and advocating for the individual patient. And I sometimes wonder if that focus on the individual can make it harder at times to step back and zoom out and look at these big structural issues. So not just environmental concerns, but other concerns about society that are negatively impacting the health and well-being of our patients.
The reason there's a gap is, as we were discussing a bit earlier, is the lack of that education throughout nursing school. And then, especially if nurses have been practicing for a number of years, then being asked or expected to know how to address these issues, but not actually having learned that.
Well, I wasn't exposed to it in nursing school at all. All my training was super, super compressed. I don't know where they would have fit in a lecture about planetary health, but I wish they had, because I wish somebody had got me thinking about it then.
What planetary health does is it brings attention to those who haven't been seen, to those who have been, perhaps disregarded or unsupported or unattended to. That's what it purports, and it does in action. And these are the direct predicate of social justice in which it's based upon. It's the direct predicate of indigenous knowledge, where it all stems from. It's the act of attending to what allows us to exist, what supports us, what allows us to maintain our communities in the same realm that social justice is. They are absolutely parallel and intersecting because it requires a social justice lens to care more, to understand more, and to be kinder to others.
This is a key part of being a nurse and being aware of inequity. And it's one of the reasons I want to work on climate change. The way I see them intersecting is the people who contributed the least to the problem are the ones suffering the most. So a homeless person on the downtown east side who has absolutely nowhere to go to get cool during a heat event is probably not the person jet setting around the world, driving 3 cars, eating beef 3 times a week, and, wasting a lot of resources. And yet they're the people who are likely to die in the next heat event.
As I see from talking to young people, talking to service providers that work with them, that certainly climate change is impacting young people's mental health in a number of ways. Professional sense, but I went through the heat dome and just seeing how that, hundreds of people died in the Lower Mainland. And I've talked to nurses and I've talked to other healthcare professionals, friends of mine, who are deeply impacted by that emotionally and mentally as well. Part of the nurse's role to push not only for health at the micro level, but also at the macro level. Even think of a public health nurse.
About how could we do this with a smaller carbon footprint? Thinking about waste. Is there a way we could, take less supplies in to the room so less has to be thrown away? Some of those kits, the dressing change kits that have all these plastic things in there that we don't use and we routinely throw away.
That's okay. It takes all of us doing perfectly imperfect things to actually make a change. So you don't have to be perfect in every single aspect of your life, but just being conscious of the things that you can do and doing them to whatever capacity that you can is great.
I think that if I were to wallow in my eco-anxiety and distress, that would not be beneficial for me. So having taken action in all these different, I've been with CANE probably since 2017 at least. This has been really very cathartic for me to find my people and to be able to do the work that I really am passionate about and to find some allies to do it with.
Action is the best antidote to despair. And that when you're feeling like, I'm just despairing, there's nothing I can do that's going to make a difference, take some kind of action. We're so fortunate in BC that most places you live in BC, we're surrounded by parks and forests. And for me, it's just to get outside and remember that in spite of everything we've done to it, it is still such a beautiful earth. And there's so many pockets of peacefulness and beauty, and there's so much that's worth saving.
Planetary health is very, very important. The powers of being have to listen to people who really know things about it, They have to